I would like to raise the issue of inpatient beds for mental health services, and in particular for patients suffering from anorexia nervosa. We have learned by way of parliamentary question tabled by the leader of Fianna Fáil, Deputy Micheál Martin, that the state provide a mere 3 specialist beds at St Vincent's in Dublin for adults with the disease, and there are no dedicated CAMHS inpatient beds for eating disorders. It is a disease with a shockingly high mortality rate of 20%. We have families around the country crying out for inpatient beds for their children and young adults, and I have one particular case that I have brought to the Minister's attention, along with a myriad of GP reports recommending urgent inpatient treatment for this person. Yet to date, there is still no inpatient treatment available for this person. This person has spent various amounts of time in St James's Hospital receiving acute treatment. However, this does not address the underlying issue in relation to the disease, and it does not provide a long-term remedy for the illness. We saw great work of the emergency services over the weekend. We saw stellar work done by many doctors who were working on the ground in some of the coldest nights, ensuring homeless people were brought in from the cold. And I noted 2 particular cases where 2 homeless people were committed. I have to say I was struggling with this concept, but I understand and accept that the doctors working on the ground were acting professionally and responsibly, and their hard work ensured that 2 people who, if they stayed out in the cold, may have died. So for that I would like to commend them. In the meantime, if we can provide inpatient beds in these scenarios, we must look and be able to provide inpatient beds for families of people with anorexia crying out for inpatient beds. And this, unfortunately, a lot of the time is a disease that affects women, not always, but a lot of the time. And in this situation, I have multiple GP reports supporting this person's case for an inpatient bed, yet we still don't have one.